Hi, it's Megan. I have chosen to do my persuasion speech on medical marijuana and the effects that it has on brain tumors. Marijuana has been regarded as a harmful plant that can endanger life and is thought to be nothing more than an extra problem to be dealt with in today's society. However, based on its economic value and medical benefits, the cannabis has been proven to outweigh its negatives with numerous other positives. I am here today to try to change one person's outlook on medical marijuana by sharing a little about my little cousin Aiden. Aiden is 5 years old, and he suffers from brain cancer, specifically pilocytic astrocytoma. When Aiden was first diagnosed, he had only one tumor on his brain, which was on his brain stem. Aiden has done a year's worth of chemo and radiation. He then was taken off of the treatments for his 4-month break to allow his immune system to build back up. When Aiden returned back to have the MRI done to see his progress, he had reached over the last couple months, they found that Aiden has 3 more tumors on his optic nerves, which caused him blindness, and they have decided that the tumors are inoperable. The only treatment left is more chemo, which it could cause Aiden to have numerous major side effects. With the legalization of medical marijuana, it could possibly save his life. There are many benefits a person might get from medical marijuana. Today we are going to talk about the effects and benefits that it could have on one who has a brain tumor. The THC in the marijuana has shown in previous scientific studies that it does indeed help prevent tumors from forming. It also helps to cure tumors on the brain. The process is called autophagy. Is the process in which tumor starts to eat themselves instead of eating the healthy tissue to where it allows the tumor to grow. Without the healthy tissue for the tumor to grow on and to eat on, it can no longer grow. Which, by using medical marijuana for brain tumors, it keeps the person from having to endure all the side effects of the synthetic drugs that are used for that purpose. In 2008, a few Spanish researchers was the first to note this finding. They did this by giving a few patients a couple doses of THC with notable improvements within 2 weeks. They administered injections straight into the patient's brain with the THC versus injecting it into their bloodstream. The 2 patients had one of the most deadly brain tumors known to man. The patient's glioblastoma multiforme is one tumor that will go away and come back numerous of times. With the THC injections, they noted a drastic difference in the size of the tumors and without all the deadly side effects that one could occur with the synthetic drugs that normally used for treatment of this disease. It could even cause death. Marijuana increases the dopamine level in one's body, just like with any other recreational drug, such as caffeine, alcohol, cocaine, or tobacco. Dopamine is known as a chemical in the brain that helps regulate its activity. The chemical is known as a neurotransmitter. It is also known as the feel-good drug or chemical. Unlike most drugs, marijuana raises your dopamine level in a whole different way than alcohol, tobacco, cocaine, or caffeine. Marijuana releases a chemical called cannabinoids, which directly increases the dopamine level of one's body, blocking the action chemical known as GABA. GABA is also blocked by a natural cannabinoid that the brain naturally releases, known as endocannabinoids. It is believed to play a role in the release of dopamine on a day-to-day basis. Marijuana has little to no long-term effects. The only known side effects would be little withdrawal, in which the dopamine levels fall back down to normal levels. The way it is stated in the legislation in the state of Ohio, House Bill 153, would allow patients with a physician's recommendation to possess up to 200 grams of usable marijuana and grow up to 12 mature marijuana plants. According to a May 2013 Fox News nationwide telephone poll of 1,110 adults, 85% of those Americans favored allowing doctors to authorize specified amounts of marijuana for patients suffering from serious illnesses. If people would just read the bill and realize how many people and families could benefit from marijuana being legalized, the medicinal reasons could save someone's life, such as my cousin Aiden's life. There are so many reasons that it would be a great idea to make medical marijuana legal in all 50 states. If I could change one person's outlook on marijuana by sharing my cousin Aiden's story with you all, then I have reached my goal with this speech. There is more than just brain tumor patients that can be helped with the legalization of medical marijuana.